Hello, and thank you for watching our video on anesthetic management for people having urologic surgery. Surgery involving the urinary system, which includes the kidneys, bladder, ureters, and tubes, is referred to as urologic surgery. It is essential to administer anesthesia safely and effectively during these operations while reducing the possibility of complications. The specific anesthetic considerations and best practices for patients having urologic surgery will be covered in this video. A comprehensive preoperative assessment is essential prior to any urologic surgical procedure. The patient's medical background, including any past experiences with allergies, medications, or surgeries, will be examined by the anesthesiologist. The patient's urinary system and any conditions that could impact anesthesia, such as bladder or urethral obstruction, will receive extra attention. The patient's general health and any comorbid conditions that may raise the risk of problems are other factors the anesthesiologist will take into account. Anesthesia options, the type and length of the operation, the patient's medical history, and the surgeon's preference all play a role in determining the best anesthesia for urologic surgery. All three types of anesthesia, local, regional, and general, can be used singly or in combination. The best course of action for each patient will be decided in careful consultation with the surgeon by the anesthesiologist. Intraoperative monitoring. The anesthesiologist will carefully watch the patient's vital signs, such as blood pressure, heart rate, and oxygen saturation, during urologic surgery. The patient's fluid balance and urine output will also be observed by the anesthesiologist because the surgical process and anesthesia can have an impact on these factors. Postoperative pain management. Patients frequently experience pain and distress following urologic surgery. The surgical team and the anesthesiologist will collaborate to create a pain management strategy that lowers the risk of complications while assuring patient comfort. Combining pharmaceutical and non-pharmacological methods, such as patient-controlled analgesia, epidural analgesia, or local anesthetic infiltration, may be used to achieve this goal. Postoperative care. As the patient recovers from anesthesia following surgery, the doctor will continue to keep an eye on their vital signs and pain threshold. The patient might need a urinary catheter or other specialized postoperative care, depending on the operation. For the patient to receive the finest care during the healing process, the anesthesiologist will collaborate closely with the medical team and surgeon. In conclusion, urologic surgery necessitates careful evaluation of the particular difficulties the urinary system presents. In order to ensure secure and efficient anesthesia during these operations, the anesthesiologist is essential. The anesthesiologist can help to reduce the risk of complications and guarantee the best outcome for the patient by conducting a thorough preoperative assessment, carefully choosing the appropriate anesthesia options, and closely monitoring the patient's vital signs and pain level throughout the procedure. I appreciate your attention. Thanks for watching.